Hi, welcome to Chapter 2. This chapter is mainly about reading doctor's orders, making sure you enter things correctly, knowing how to understand how you give patients their medicine. On the beginning of this, you'll see that you have a large sheet that gives you a whole bunch of different abbreviations. If you don't know these now, you will need to know them. Now, I know that the abbreviations that are used in nursing change quite a bit. These are the ones used in this class, so if you see something different, that's okay. Use the one they tell you to use, but in this class, this is what you should expect. Okay, we will be referring to this a lot. Okay, so our first problem. We are given this prescription, okay? And then we're asked to give a bunch of information from it, okay? So the first thing we want to know is the date that the prescription was written. So I come back up here. Here's the date, 10/22/13. Okay, the patient's full name, Mary Morrell, whatever, we just have to write it down. Okay, the patient address, it's right up here. So that's 124 Winding Lane, Manhattan, Kansas. (10001). Okay, patient date of birth, it's right up here, 4/29/52. Okay, now here's where things get perhaps a little bit difficult. They ask for the generic drug name. If you come up here, usually the trade name will be capitalized and the generic will not be. So the generic drug name is doxycycline. Okay, the dosage. The dosage is 100 milligrams. It's going to be critical that you write down your units on these because it can make a huge mistake if you don't. Okay, so what route do we take it? Now what they're asking for is, is it taken orally? Is it inhaled? Is it IV? Whatever. Okay, so the route. I come back up here, take one capsule, PO, BID, for 7 days. Now what does PO mean? I'm looking back at this chart. PO means by mouth. And then we have the BID, which means 2 times a day. Okay, so it's taken by mouth. And then our frequency was 2 times a day. The amount to be dispensed. So how many capsules are they given? Right up here, they dispensed 14. So they give 14 capsules. Is it acceptable to substitute a generic? We come up here and it says right here, substitution is mandatory unless the words no substitution appear in the box above. There's nothing written here, so it is okay to give a generic. So yes. Okay, now the directions to the patient. Basically, we need to take this and turn it into, this and turn it into something that makes sense to most people. Okay, so the direction to the patient. So what we're going to do is we're going to take one capsule, twice a day. Okay, and now are they allowed to give refills? Come back up here, refills is 0. So no refills. This isn't so hard, you just have to know where to look. Okay, and then once you get your abbreviations down, it's just going to be like reading. It's just going to make complete sense. Okay, So let's go to the next one. This is a physician order sheet. Okay. So we're going to be asked kind of a lot of the same things. This has some other information on it. Okay. First of all, that we have a nurse who entered a lot of the information. We have to ask about that. We're also given some information in here that we did not have on the other one. Our time is given in military time. Okay, 24-hour clock. All right, so let's answer our questions. The date the order was written. Okay, the date is 11/22/13. That looks like a B. 13, let's make that better. Okay, now what time was the order written? Well, it was written at 1800 hours. And that is equivalent to 6 p.m. Okay, what is the name of the drug? Azithromycin 1% ophthalmic solution. Okay, so that's what all needs to go here. Okay, so now let's look at the dosage. What is it we were asked to give? We were supposed to give 1 drop, BID, that's twice a day, right? For 2 days, then daily for 5 days. So the dosage is 1 drop. Okay, that's the dosage. It doesn't tell it, we have to talk about the frequency down here, okay? What is the route of administration? Okay, this is ophthalmic. This means eye. So, and we're putting a drop on something. So this is topical. And it's applied to the eye. Frequency of administration. Here's where we do 2 times a day for 2 days, and then daily for 5. Okay. The name of the prescriber. So this would be the doctor. Here's the doctor, Mei Ling. Okay. The name of the patient. It's Catherine Rodriguez. The birth date. Well, this is the same as this date, so that must be the prescribing date. Here it is, 12/1/62. 01/62. What is the religion? Here's some new information. If you look on here and you read through all of this stuff, PROT, this person is a Protestant. Obviously, that's not indicated on all. The type of insurance, I had trouble finding this, but it's GHICBP, which I don't recognize as insurance, but obviously it is. Okay, and then the person who transcribed the order. This is where we find that the nurse did it. Okay, so the person who transcribed the order is Sarah Gordon. RN. Okay, so let's try the next. Okay, this is an MAR, which means a medical administration record. So what we're going to do here is it has, basically it has information about the patient. It has all of this stuff, what room they're in, allergics right here. And then allergics, that's a really good word. How about allergies? Okay. Here are your drugs with their individual information. This indicates when the drug was given, and the initials here tell you who gave it, and the initials correspond to the names down here. And then there are codes for injection sites, so all of these would be used. Okay, let's see what information we are asked to find. Okay, I actually have, since this is on the front and back, I have another sheet with a MAR on it, so we can refer to it. First thing we're asked to do is to fill out this chart, okay, which says where we're supposed to give the name of the drug, the dosage, how it's administered, and when it's supposed to be given, okay? So if you look at your chart here, what is the first drug we have? Cefta something, okay? I don't know what it is, but I'll copy it over. Where? Okay, I'm sorry, I got confused there for a second. All right, so the name of the drug. Okay, and then the dosage is 1 gram. Okay, the route of administration, IV PB. And if you refer to the sheet, the first page, IV PB is intravenous piggyback. So this is an IV a piggyback IV. Okay, and what times should this drug be administered? It's supposed to be given at 0600 hours and also at 1800 hours. Okay. Now for the next drug, Digoxin. You know, I'm math. I'm not medical, so these drug names are tricky for me. Let's see. The next drug is that. The dosage is 0.125 milligrams. Okay. The route of administration, it says PO, and PO means by mouth. Okay. And then when is it supposed to be given? 0900 hours. Okay. Here's the next drug. Can you see it all? Yes, maybe. All right. Lotensin, and I probably should write in the generic. I just don't have a whole lot of room. The dosage is 20 milligrams. PO, so by mouth. And it is supposed to be given at 0900 hours and 2100 hours. Okay. The next, Plavix. And the dosage is 75 milligrams. PO, so by mouth. And it is supposed to be given at 0900 hours. Okay. And then there's just one more drug. Okay. And it is a 15 milligram by mouth. Okay. And then it's supposed to be given at 2100 hours. Okay, so that's the chart filled out. Now for the rest of it. Okay, we are asked to identify the drugs and their doses administered at 9 a.m. Okay, well, 9 a.m. is 0900 hours, and it was given, let's see, Digoxin, Lotensin, and Plavix were given at 0900 hours. Okay, so Okay, and then it was Latensin, and that's a 20 milligram pill, and then Plavix, a 75 milligram pill. Okay. Identify their drugs and their doses administered at 9 p.m. Well, 9 p.m., you just take 12 plus 9 to get 21. So 2100 hours is 9 p.m. 2100 hours were these two. So Latensin and Transine. Okay. Now, who administered this drug, which is the generic name, on the September 14th? Okay. So first thing I'm going to do is I'm going to look and find this generic name, which is right here. It's generic for Plavix. Okay. We are looking for 9/14. So the 14th is 14th is here. Okay. Those are the dates given. And then what time was it we were supposed to be looking for? Who administered that? Okay. Who administered this? JY. And JY is Jim Young. Okay. What is the route of administration for this? So that's a generic. Let's look for that. That's this one. Okay. And how is it given? IV piggyback. Okay. And then what time is this pill supposed to be given? So let's look at for that generic. Okay. That would be Latensin. And it's given by what time? Listen, what time is the administration? Okay, so the time is 0900 hours and 2100 hours. Okay, so that's that problem.